Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. Touliatos, and brought to you by his book, The Bible of Bodybuilding, available on Amazon.com. Everything you need to know in there about training, nutrition, supplementation, and of course, PED use. And if you're looking for great bodybuilding books on Amazon, wow, Real Bodybuilding by Ron Harris. You could read that book too. All right, and now all the way from Athens, Greece, please welcome the good doctor, Dr. Touliatos. Welcome, Doc.
Hi, Ron. Have a nice week. So let's move to 180 episode. Huh?
Yeah, 180. Oof, so 20 away from big 200. Yeah. Who are we getting on to? 200 we're going to do live. We already decided that, right?
Well, I'm between live and another with Steve.
Okay. Yeah, I mean, those are both good ideas. We got time. We got 20 weeks. It's almost 6 months. So we have time. Well, you have great questions this week. Let's start with the first one. Hi, Dr. Touliatos. I'm on TRT. And I use 125 milligrams of Sustanon every 6 days. I have two questions, so I'll give you them one at a time. Number one, I use Armidex 0.25 milligrams every 3 days. With that dose, my oestradiol was 15 and 19 ng/L in the last two blood tests. I do a test every 6 months. Oestrone was 7 and 17. Are the results too low? Should I perhaps take quarter milligram of AI every 4 days instead of every 3 days?
I think there's no need for Armidex with such a low dose of 125 milligrams per week. And better to split 2 quarters of that. So 0.25 twice. So roughly he's taking half a ml. So 2 quarters are equal 62.5 milligrams per week. In this case, he will split the single dose, the single monodose, the weekly monodose, and in this way he will avoid the spiking of estradiol. So it's overkill using an androgel so frequently with such a low dose. And this guy is obsessed perhaps with estrogens. That's why he's calculating also Oestrone. So he needs estrogens for his endothelium, for his sex drive, for his mood, glycogen synthesis, blah, blah, blah. He doesn't need to crash estrogens, and this estradiol and estrone are very close to the lower range, so you can still have, I need to see how much is the total testosterone. I guess it's about 500, but there's no need for an aromatase inhibitor with such a low dose. He has to give a break.
Okay, and he had a second part of his question. He says, I use ovitrelle pen for HCG, 520 IU every 7 days. Is that enough to keep testicular functions and fertility? Well,
better to split those 500 IUs into doses of 250. I'm sorry.
Yeah.
So instead of 125 testosterone, he has to do twice a week, half of this dose, plus 250 of HCG, the same dose. Better to split the 502 doses as well. This way he will minimize also the elevation of estrogens.
I didn't even know that HCG came in a pen like growth hormone. Is that only in Europe?
Yeah, it does, of course, and in Greece, but it's withdrawn now and we cannot use it anymore.
Oh, okay. Here's a good one. This is talking about the old days of steroids. I heard that once upon a time, the medical dose of the original Dianabol was 10 milligrams per day. Is this true or false?
Yeah, I guess it's true. This is how the medical prescribed doses, very moderate, but it was a real deal Dianabol. I was working from SIBA,
Yeah.
It's not the BS now that it's available online that you use 50 milligrams. It's like, what do you say, flour inside and just 5 milligrams,
Yeah. I remember John Balick, who used to own Iron Man magazine for years, and he trained during the pumping iron. He trained with Arnold at one point. He said his whole drug cycle was 1 Dianabol tablet a day. That was it. Him, not Arnold, him.
I was taking back in 2000, 5 milligrams of Dianabol from Bulgaria. It was so potent, man, straight from the pharmacy, man.
Wow. Yeah.
Yeah, you could take 5 of them and feel like a monster,
Yeah, I remember around that time, they used to sell these big tubs of Anabol.
In the British Dragon, huh?
British Dragon. Yeah, it was like they came in like
yes.
There were like 1,000 of them in a tub or something ridiculous. Man,
imagine if you buy 1,000 fake. Huh?
Oh, I've done dumber shit than that. Trust me. Okay, here's our next one. I'm on TRT and I'm on androgel. and I'm on androgel 1%, 10 grams a day, every day. My testosterone level is 930 to 1100 with androgel, average in years. Free testo is more than 3% for sure. Don't remember the exact number. Estrogen is normal range. Everything else is normal, except red blood cells, sometimes spikes just above normal and goes back to normal after some time. My question is, what is the equivalent in milliliters testosterone enanthate shot a week versus gel, androgel? I don't know what the equivalent is injectable. Is it better in gel or shot?
Now, the gel, the cream provides steady levels on a daily basis. The disadvantage of the cream is the cost because 90% is wasted. However, the new generation of creams is liposomal and very dense, very potent, concentrated. So it's 20% rather than the 2% from the pharmacy.
Oh.
Now, this guy, he uses what he used with the cream, and his levels, the trough levels are around 900. This is elevated. In order to reach 900 with an injection, you certainly need 150 to 200 milligrams for sure.
Oh, at least.
Okay. The trough levels means to take the blood, to drop the blood the day of the shot, but just before the shot, the lowest levels, you know?
Yeah.
So around 150, 200 milligrams, you reach close to 1,000. Okay. Depends on the body mass index and the metabolic rate of this particular guy. But yes, you can reach the upper limit with 150, 200.
Okay. Yeah. So the gels they've gotten better. They've got the liposomal delivery system now.
Yeah, the liposomal on the high concentration, the 20% is 10 times more dense and concentrated than the cheap ones. And they're alcohol based on the market, you know?
Yep. Yeah. Definitely more expensive though.
Another thing is it matters where you apply the cream. The best is here with the veins, you know?
Yeah.
Or your balls. Otherwise, if you are obese and you do it in your adductors, it's over because it's full of fat, or in your stomach. Come on. You need to have a six-pack to absorb it properly.
See, I didn't think it mattered because it's just going through the skin. So what does it matter what's underneath the skin?
It matters. I mean, John Cleese used to say you need vascularity for that. You can do it in your jugular veins here, in your balls as long as they're shaved, or in your forearms and wrists. Now, obese people apply it in the wrists because it's very thin, the skin, you know?
Yeah, they don't have fat wrists. So.
Yes.
Okay. Here's a little bit of a long one. So sit back and relax, doctor. My name is Rohith. I'm a 44 male from Bangalore City, India. I have a question for the doctor. I'm an epileptic since I was in my 4th or 5th grade. I'm on anti-epileptic medications. I've been a regular gym guy for 21 years and have now noticed that my erections are dying and I'm noticing a faster loss in my pumps post-workout. TRT is still in its infancy in India with doctors scared to prescribe it, even after checking a patient's free and total test levels in his blood work. I face the same, and I'm around gym guys and bodybuilders for a long time, and seeing them, I use foods like meat and yolks, not to mention including saffron and honey and milk, and drinking it before bedtime. My T levels are now 520 nanograms over DL after I got this year's blood done in June or July. Can you please ask Dr. George if I can start TRT and if my anti-epileptic medications are a hindrance? Regards, Rohith.
Yes, first of all, having this kind of disease that is incurable, so you take a lifetime medical treatment that stabilizes actually your brain metabolism and we take also anti-epileptic drugs during bipolar disorder in order to stabilize the feelings. But in his case, those medications can increase prolactin. Now, prolactin antagonizes testosterone, can also lead to anorgasmia. According to his total testosterone levels, this is not an indication for TRT. However, if we look a better view down to the free testosterone, this HBG that this guy is not telling us, also the prolactin, we can estimate perhaps high HBG, low free testosterone, and high prolactin, that if we take care of them by certain medications, then he may feel much better rather than taking testosterone. He doesn't need officially at 520, you know? However, the free testosterone might be much less than this, much less than 50%, or a prolactinemia could hinder also his sex drive, estrogen as well. So at first glance, no, he doesn't need, but then he needs to check out prolactin, fasted, estradiol, SHBG, and free testosterone. That's really important, okay?
Yeah.
Now, in case this guy had a, let's say, total testosterone of 320 or 220, and he was a candidate for replacement therapy, he need to take care a lot of his treatment, because we don't want to trigger hypomania and instability in his case, okay? So perhaps DHT is out of the question, overdose of testosterone as well. I had a case of somebody who was in bipolar disorder. He was kind of suppressed, and he was not hyper, but he was not depressed also. But I told him, don't go over than 100 milligrams. And if you feel something like edgy and irritated, please stop this. And he told me that he was feeling high with testosterone plus his treatment, because antidepressants give you a lift. Testosterone also gives you a lift as antidepressant medication, because DHT is antidepressive.
Yep.
So you need to be really careful not to cause the consequences, you know, the irritability, hypomania, mania, you know, epileptic seizures. He has to take care of a lot of this. It's about neurology and brain chemistry.
So, I mean, what medications could he possibly end up having to use? If not
in case of elevated prolactin, you can take bromocriptine or cabergoline that may lower prolactin. Now, in case of elevated SHBG, usually we give DHT synthetic like Muscular or DHT.
Proviron?
No, Proviron, or which is Steroids, or DHT authentic. That means bioidentical.
Oh,
we may also give boron, you know, that may as a supplement lower the SHBG. But first of all, we need to have the facts, all right?
Yeah.
Otherwise, if it's just prolactin, then lower by dopamine agonist, that's all.
Gotcha.
We need more evidence.
So here's a weird question, because usually testosterone makes guys lose their hair, as you can see. But this guy says, has Dr. Touliatos seen or experienced any paradoxical, I think he meant to say paradoxical, reactions to TRT and steroid use, such as an increase in scalp hair growth in areas typically prone to androgenic alopecia? Since starting TRT, I have found my scalp hair is growing thicker and faster.
This happens only if you take testosterone plus finasteride or dutasteride.
Okay.
Because originally testosterone has the side effect of hair growth in your body.
Right.
And hair thinning. Now, if you block a hair thinning with those compounds, you still have more hair growth in your scalp, as long as you block the DHT.
Right. Yeah, because
so you develop thicker hair.
Yeah, I mean, you've seen female bodybuilders who use a lot of androgens. They start losing their hairline goes, but they start getting hair on their face and their chest and everywhere.
The transgender males also do this.
Yeah.
They take testosterone and proviron in order to start having beard, you know?
Yeah. Some of them have huge, great beards, you know? They grow a better beard than I could grow. So here's one. Is HCG, we get one question every week on HCG, if not more. Is it good to take with TRT? What are the benefits of HCG?
Yeah, it's not a must, it's not obligatory, you know, it's not mandatory, but first of all, you need to restore your fertility with HCG. After that, of course, your ball size and ejaculation volume, which is a matter of taste, you know, and perception, aesthetic part. Yeah. But also, according to some studies, the HCG can increase the steroidogenesis cascade, because when we take testosterone, we cut off the synthesis of testosterone and all the steroids from cholesterol. So by implementing HCG, we increase pregnenolone, progesterone, and DHEA synthesis. That gives a better overall feeling. All right. But you need to able to afford it, because in some cases it's expensive. And better applied in microdosing rather than a larger dose, because you can trigger gyno through the elevation of intratesticular testosterone will convert to estrogen eventually.
You can't be on HCG all the time like you can testosterone, am I right?
You can, but you need to microdose, okay?
Wow.
You cannot OD like in PCT, for instance, a little bit of OD in HCG because we need to give a kick.
Right.
But you can still keep your Leydig cells not going to sleep with microdosing of HCG, you know? Desensitizing is if you OD on HCG, like we used to do 5,000 of IUs, which is a lot. Yeah, we're not aware of the protocols 20 years ago, you know, we are overdosing on HCG, and this can desensitize the LH receptors.
So what's like a microdose? If I was gonna use it all the time?
Microdose, yes, is 100, 200, 250, all right, up there.
Okay, is that like every other day? Three times a week? Oh, okay.
Even 100 on a daily basis.
Wow. And you know, people do like 5,000 a week for fertility, right? So this is a very small dose.
Not that much. I mean, I suggest 3,000, 3 doses of 1,000, you know?
Okay.
But you need to add also HMG, another compound on top of this in order to enhance the sertoli and the overall effect of fertility.
Okay, right on. If you're trying to make a baby, guys, and not many people are. Do you know we now have the lowest birth rates in recorded human history?
Generally, or the States?
Everywhere, the world.
Well, in Greece, average, each couple has one child, you know?
Yeah, I mean,
you can barely do it. I mean, during the economical crisis 10 years ago, but my grandmother used to say, one child equals nothing.
Yeah, I mean,
there needs to be brothers and sisters, and occasionally, knock on wood, something happens.
Right. I mean,
you need to have other children like the old generation used to do, you know.
Well, they
3,
had
4, 5.
They had a 20 to 30% mortality rate for the first year of birth. So if you had 10 kids, probably only 6 or 7 of them would live past 2 years.
But of course, Ron, back then, life was not so demanding with cell phones and cars and stuff and computers and bullshit, you know?
Yeah, true.
I remember my dad was telling, I was wearing the pants and the trousers of my brother when he was returning from his, you know, so it was tough, but it doesn't mean that they were lacking compared to the day of success.
Yeah, I mean, there were 7 brothers and sisters in my family, and we were fine. You know, we didn't have a ton of money, but we had everything we needed.
Yeah.
All right, our final question. Hi, Doc. I've just been prescribed TRT in a gel form. Here we go again. My doctor's only concern was I had elevated liver enzymes. My ALT score was 233 U/L. I was a chronic cannabis smoker and was on Anavar prior to the prescription. I've quit cannabis for good, and I've been using the gel cream for about 2 weeks now and already feel better. Do you think I need to worry about my ALT levels in that range, or do you think it was symptomatic with the cannabis and Anavar I was on? I'd also like to switch to the injections instead of the gel. What would you recommend as a good dose to run, and what ester weekly and how often? I'm 32 years old, 190 pounds, and I've been lifting since I was 17.
Well, I think the Anavar causes a little bit of transaminemia. Now, perhaps this guy had some of the myolysis, overtraining. I don't know about painkillers, but these are the 2 main factors that affect lifters and steroid users who use oxandrolone. It's not so toxic, you know, it's the least among the 17-alkylated drugs, but nevertheless, it can elevate a little bit to digital, the liver enzymes. Now, weed, I think, elevates prolactin. Okay, can give you perhaps some gyno out of this.
Yeah.
So no worries about how much is his ALT, ST?
So it was, I don't know, he had it tested before and it was 233.
Oh, really?
Yeah.
Oh, that's high. But I guess how many milligrams of Anavar was he using?
He didn't say. It was enough to raise his ALT to that, whatever it was.
Well, people are telling me that they still swallow the pills. They don't take them sublingually. So I tell them to give a try doing this because I think it works. And break down the dose of the Anavar. Don't take 50 milligrams at once. Okay, break them down in 3 doses throughout the day, every 8 hours.
Okay, so like 15, 15, 15 or something like that. If you're doing 45,
every 8 hours to split throughout the day according to the half-life.
Yeah. You've been saying for 180 episodes, pretty much sublingual, and people still aren't listening. So let the pill under your tongue dissolve instead of swallowing it, and you get more
Your
of it gets
results were
used.
perfect, Ron. You're not using though back then your previous lab test where you're not taking pills yet.
No, I was, I think.
You were, well, it were below 50, I think.
Yeah, I mean, my mom, knock on wood, I can get away with a lot. I'm not on any orals right now, but Halloween's coming. I'll use them in October because I got to look good for Halloween.
Oh, you look great, man.
I look better. I got to look like contest ready for Halloween. I'm gonna dress like a gladiator
Oh.
or a Spartan, something like
You're
that.
lean now, man. You're below 10% now for sure.
Yeah, but I can get leaner. I'm back up to like 218. I need to be around 210 to really look
Now
good.
you're 218. 215 looks good.
I need to drop. I gained a couple pounds again. I need to go back down, but we'll see. Yeah. All right. Well, that is the show for this week. Thank you, doctor. Guys, if you have questions for next time, please leave them in the comments below. If you like these videos, guys, please share them. Please give a like to the video, subscribe to the channel, do all that, because I think this is a very special opportunity we have here every week. A medical doctor who is a champion bodybuilder. He's walked the walk, talked the talk. You don't get a chance to ask these types of questions to many medical professionals who actually know the answers and have dealt with patients and themselves. It's a cool thing. So thank you.
You know what? Yesterday, Rick Collins posted a site from a paper saying officially now that low testosterone increased the mortality in COVID patients. I've been saying that since last year when I had my column in online MD. The low testosterone equals visceral fat that triggers cytokines and take part in the inflammatory cascade. And funny how doctors were laughing and being sarcastic and bitter on this and start speaking about doping and bullshit like that.
Yeah.
And now, you know, it's redemption time for me.
But they always start out laughing and ridiculing and dismissing stuff. They always, and then eventually,
you know.
Yeah. But then they do a couple studies and they go, oh, maybe this guy was right. And then they, it usually takes a while to get vindicated like this. But yeah, you were right. You called it a long time ago right here on this show. So, all right. Well, let's not use the C word too much anymore. Everyone's tired of hearing about COVID, even though it's still around. My goodness. Anyway, doctor, thank you so much for the show. Appreciate you doing this every week with the viewers. And that's episode 180, guys. That's 180 episodes. You can go back on YouTube. There's so much information. And we appreciate your viewership. So we'll see you next week right here again on Ask Dr. Testosterone.